Hello everyone. Today we are going to discuss interesting facts and knowledge about burns and how will help physiotherapists. Okay, I'm Dr. Vishnu Soni. Right now working as General Surgery Assistant Professor in GMC Sangareddy, Government Medical College. So I hope people have joined. Okay, right. Then we are starting with burns. So I'm not going to discuss all the points. I mean, the points which you all know, but I'm going to discuss things which you don't know because I have recorded a detailed video on Prakara. You can go there and see and watch that video so that you'll get the more detailed knowledge. But here we are going to discuss an overview of burns. So, what is the definition of burns? Definition of burns is damage or injury to the skin and the underlying structures due to extreme energy of source like heat, cold, radiation, thermal, and also electricity. These are the things which will cause injury to the skin and the underlying structure. Basically, burns. What do we think of whenever we hear the word burns? We get to know, or we think that it's an injury to skin. But to everyone's surprise, it's not only injury to skin; it is also injury to the underlying structures. So basically, burns जितना दिखता है उससे बहुत ज्यादा डिस्ट्रक्टिव है. It hurts more than what is seen, so it injures skin and underlying structures as well. All right, I'm going to I hope everyone is getting to see the PPT. So we are getting to see now the PPT, the understanding burns, a surgical perspective for physiotherapists. Right. So first slides, what are burns? I've explained this in, I'm explaining it again. Burns is nothing but damage or injury to skin and underlying tissues primarily caused by unprotected exposure to extreme energy sources like heat, cold, chemicals, electricity, and radiation. Okay, I've said this that it will injure not only the skin but also underlying structures as well, like subcutaneous fat, tendons, muscles, nerves, blood vessels. Everything is injured in burns. Are burns only caused by fire or any other hidden dangers? No, I've said yes. There are other things to it. Like burns aren't just caused by fire, they are also caused by thermal, radiation, chemical, and electricity also. Right. So, pathophysiology. Pathophysiology, basically, what happens in burns is energy gets transferred. The energy which is there outside gets transferred to the skin and then the underlying structures. What happens due to that? There is heat transfer. When the skin is exposed to high temperature, the heat energy is transferred to the tissues, causing damage at the cellular level. What is the cellular damage? Heat causes proteins to denature and cells to rupture. The cell membrane integrity is compromised, leading to leakage of cellular contents, including electrolytes and water. What happens due to this? Due to the same reason only, there is formation of blebs. Blebs is nothing but fluid-filled cystic lesion, which you see on the burns patient's hand. The bleb, the fluid-filled bubble which you see, is nothing but due to leakage. The cells get damaged, and the intracellular fluid which was there inside comes out, and this leads to formation of blebs and also edema, swelling which we see in the zone of burn or burn injury area. The reason is cellular damage. Okay, next going to zone of injury. This is much important. Why we need to know the zones? I would just like to show you the zone with the diagram. Right. I hope I'm visible. Okay. So I have a board here. I'll draw the diagram of the zones. Zones of burn. What happens here is, if this is the burn area, the center zone, the centermost zone is called as zone of coagulation. Then surrounding this is zone of stasis. And outermost, this part of the zone is called as zone of hyperemia. So yes, these are the zones. The centermost zone is called as zone of coagulation. Here, this part is caused by the burn. This is an irreversible injury. The cells here are died. Irreversible. You cannot reverse this zone. Zone of coagulation is dangerous zone. In this zone, the cells are dead. There is black formation, black color ischar is formed, and this is an irreversible zone. You cannot reverse this. Then the next zone is called as zone of stasis. What happens here is the tissue surrounding, this is the tissue surrounding the zone of coagulation. What happens here is, here the vascular permeability, the vascularity is impaired. Here the vascularity is impaired. In zone of coagulation in center, the vascular is gone. You cannot do anything about it. But in zone of stasis, surrounding the zone of coagulation, surrounding the core, there is one more zone called as zone of stasis. In that, the vascularity is impaired. So, if you resuscitate the patient, if you give the fluid, what happens? The vascularity comes back. So, this zone is reversible. So, you can argue with me, why do we have to resuscitate or give fluids to the burns patient? Just to save this zone. Because this zone is vascularly impaired, just to save this zone. If you give fluids, the vascularity will increase. The blood will get supplied here and this zone will survive. Just to decrease this damage, you do fluid resuscitation, because this zone is reversible. If you resuscitate the patient as soon as possible, then this part of injury can be avoided. If you don't resuscitate, this will also land up into zone of coagulation, and this will also become irreversible zone. Then you lose the skin here also. And this part of the zone, the outermost part, is called as hyperemia. This is an zone where there is increased blood flow, and it is zone of vasodilatation. There will be vasodilatation. This will spontaneously reverse. This requires no treatment. Zone of hyperemia requires no treatment. It is reversible spontaneously. So these are the three zones. Zone of centermost zone is called as zone of coagulation. Next to it is zone of stasis. Next to it and outermost is zone of hyperemia. So you cannot do anything about zone of coagulation. You have lost it. Then the zone of stasis. It is an reversible zone. You do resuscitation for burns patient due to this zone only, because you don't want to lose more of the skin and the underlying structure. So you resuscitate. Again, going back to our PPT. Yes. So zone of injury, zone of coagulation, zone of stasis, zone of hyperemia. There are three zones. Zone of coagulation, the central area of the burn where tissue is irreversibly damaged and necrotic. I've said you this thing. This zone is characterized by coagulative necrosis. There will be necrotic. I said there will be ischar formation. There will be dead cells there. So the necrosis there is, type of necrosis is coagulative necrosis. Next is zone of stasis. Surrounding the zone of coagulation, this area has decreased tissue perfusion and is at risk of progressing to necrosis if not properly managed. I've said you this thing. If you resuscitate properly, you can save this zone. That is zone of stasis. Next is zone of hyperemia. The outermost area where tissue is inflamed but still viable. With proper care, this zone can be recovered fully. Even it recovers spontaneously. Inflammatory response. Yes. Due to what? Due to this leakage from the cells and leakage from the blood vessels, what happens? There will be an inflammatory response. Mediators will be released. So, burn injury triggers the release of inflammatory mediators such as histamine, prostaglandins, cytokines, react to oxygen species. These mediators, what will they do? It will cause vasodilatation. Same reason. why there will be edema, increased vascular permeability, and fluid leakage into interstitial space. Edema formation, yes. The increased capillary permeability leads to significant fluid loss from the vascular system into interstitial space, resulting in edema. I've said you already this thing. And due to this permeability, vascular permeability, and the vasodilatation, what happens is there is a leakage of intracellular fluid outside into interstitial compartment. This leads to formation of edema. And also, yes, last point is very important. This is particularly severe in large burns and can lead to hypovolemic shock. If there is a burn area is very much big, there will be lot of fluid loss from from the vascular compartment. The fluid is lost into the interstitial space. So the inside the vascular compartment, there will be decreased fluid, and this will lead to decrease in hypotension, and it will lead to hypovolemic shock. Next, systemic response. There will be fluid and electrolyte imbalance. The patient goes into shock. There will be hypermetabolic response because burns trigger a hypermetabolic state leading to increased energy expenditure, protein catabolism, and muscle wasting. Immunological response, I've said you again this thing. Immunologically, there will be release of cytokines. So, what happens due to that? The inflammatory response and the loss of the skin barrier leads to compromised immune system. Yes, anywhere there is a simple cut on the skin, that is also that is also probably a damage to the barrier. Skin acts as barrier, so there will be damage to barrier in small cuts also. And here in the burns, there is lot of tissue loss. So a lot of skin and underlying structures are lost, and this will be a huge defect in the barrier. So it will leads to infections, risk of infection, sepsis. The microorganisms which are present naturally onto the skin, they enter inside and cause havoc. They cause infections. So the necrotic tissue and the compromised blood supply in the zone of stasis create an environment conducive to bacterial growth, further increasing the risk of infection. Yes. So zone of stasis again becomes an environment or bed for the bacterial growth that will again lead to the infection formation. Immunological response. The inflammatory response and the loss of the skin barrier leads to compromised immune system. Yes, this is the same point. Wound healing. Yes. What happens? Okay, everything said and done. How does the wound heal? Yeah, there is a burn injury. How does it heal? It has wound healing as three phases. First one is inflammatory phase. Immediately after the injury, the body attempts to remove necrotic tissue and control infection through inflammation. By in this inflammatory phase, there is nothing more for healing process. But what does the body do is, due to vasodilatation and all, there will be accumulation of inflammatory cells in the zone. To remove all the necrotic tissue and the infection, there will be inflammatory cells such as macrophages. They eat up the dead tissue. So that happens in inflammatory phase. All the inflammatory cells gets collected at the site. Proliferative phase. New tissue formation begins with granulation tissue, angiogenesis, and reepitheliation. Once the dead tissue and everything is gone, that starts the process of rebuilding. The granulation tissue, angiogenesis, that is new blood formation. Again, the reepitheliation is again the new skin formation. Everything happens in proliferative phase. Maturation phase. Remodeling of the wound occurs. Their collagen reorganization and scar formation is done. This phase will last for years. Yes. It will last until we die. The proper wound healing maturation phase will not end anywhere. It will keep on maturing. Yes. So that's how the scar formation is done in maturation phase. These are the three phases of wound healing. Next, assessment. What all we are going to discuss in this webinar is depth of burn, total body surface area, location of the burn, age and health of the patient, cause of the burn, and inhalational injury. Right. Degree of burns. First, starting with degree of burns, there are 4 degrees of burns essentially: first degree, second degree, third degree, and fourth degree. What is first degree? First degree is just an injury to epidermis. It is an injury to epidermis or outer layer of the skin. The skin will be, after this injury, how does the skin look clinically? It looks red, painful, and dry with no blister. Blister is nothing but, I've said you, it is an bubble, fluid filled bubble. So in first degree, you don't see anything. You just see a red color zone, red color area. Wherever the burn is there, you see the red skin. It will be very painful. Why it is painful? Because there will be nerve endings in the dermis and epidermis part. There will be nerve endings, which becomes which gets exposed to outer environment and they get irritated. So nerve endings get irritated. So only we'll have pain. So that is first degree burn. Example of first degree burn is sunburns. Due to extreme exposure to sun, there can be sometimes a sunburn to our skin. That is an example of first degree burn. Second degree burn, it involves epidermis and part of dermis. So dermis has two layers essentially. These are papillary dermis and reticular dermis. Secondary, second degree burns are divided into superficial and deep. So second degree superficial will get involved with papillary dermis, and second degree deep burns will get involved with reticular dermis. So yeah, in second degree dermis is involved. You should remember such way only. In second degree, there is involvement of epidermis plus dermis. Okay. How does the site look? It looks red. It is swollen. It is blister. Blister will be there. It will be wet. Swollen blisters will be there, and it will be very painful. In third degree burns, it is the involvement of whole of the epidermis and whole of the dermis. Both layers of the dermis are involved. That is papillary and reticular dermis. How will be the site look? It can be look white or gray white or black, depending on how much area is involved. Okay. So it will look, it is hard, it will be leathery, hard, and it will be very painless because all the nerve endings are lost. All the nerves are damaged. So there will be no pain in third degree burns. Whereas in fourth degree burns, it is involvement of whole of the skin and underlying tissue, that is subcutaneous. Even under it, muscle, bone, if they are involved, tendons are involved, it is fourth degree burns. So yes, these are 4 degrees of burn. First degree, second degree, third degree, fourth degree. First degree, there is involvement of only epidermis. Second degree, there is involvement of epidermis plus dermis. Third degree, there will be involvement of whole of epidermis, dermis, and also sometimes subcutaneous. Fourth degree, it is an deep burn where muscles, bones, tendons are also involved. Yes, total body surface area. Again, I want to just explain you with my diagram, but then yeah, first we'll go through this slide. What are you seeing here? What are you seeing here? It is head is given as 9%. Basically, total body surface area. This is called as rule of 9, Wallace rule. By this total body surface area, you estimate how much percentage of body is burnt. Everywhere there is 9% or multiples of 9. Face is 9, hand, upper arm, upper limb, right upper limb, left upper limb, 9% each. And then upper part of the chest, first half of the front part of the chest, 9, back part 9, lower part abdomen 9, back part of abdomen 9. So it is written as front 18, back 18. Whole of the lower limb is 18, and one more other side of the lower limb is 18. Genital is 1%. So this is whole of rule of 9. I would just draw you the diagram and explain you this thing. I hope I am visible. Yeah. So we are talking about rule of 9. So this is face, this is trunk, this is upper limb, this is genital. Right. So you can see the diagram here. I hope the diagram is visible. Right. So head is given 9%, both front and back part of the head is given 9. This is 4.5, this is 4.5. So head and neck is given 9. Upper limb 9. Lower limb 9. Front part of the chest, this is divided into half. This is umbilicus. So front part is given 9. Back part of the chest is given 9. Then front of the abdomen 9. Back of the abdomen 9. Upper part of the lower limb is given 9. Lower 9. Upper 9. Lower 9. Genital is given 1%. You're seeing this? Yes. So what happens? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. 9 into 11 is 99 and 1% is genital 1%. Genital is 1%. So this is total of 100%. Yes. So this is rule of 9. By this you can assess total body surface area burnt. TBSA is nothing but total body surface area burnt. Another rule is rule of palm. Okay, so yeah, that is rule of 9. We'll go back to our slides. Yes, so total body surface area burnt, TBSA. How do you calculate it? Rule of 9. This is how you calculate it. Okay, location of the burn. How? Why is identify location of the burn is critical in burn? Because there are few very important parts in our body like face, hands, feet, groin, and joints. These are the places where you need to have special care. Why? Why is the special care needed in this area? Because function and mobility. These areas are vital for daily activities. Yes, burns can lead to scarring, contracture, loss of function. Sorry, significantly impacting a person's quality of life. Okay, suppose for example, if there is joint involved, suppose knee joint is involved, and this will lead to the formation of immobility. There will be formation of contracture. Then it is difficult for the patient to walk. So whenever the joint is involved in the burns, you should be more critical. You should be more vigilant about these areas. Why? Next, sensory nerves. The areas have high concentration of sensory nerve. Face is highly sensitive area because there are so many nerves on the face. So burns can cause severe pain and discomfort in these regions. Cosmetic, yes, face is involved. It is very cosmetically important to the person. So involving the face will hamper the look of the patient, affect the self-image and the self-esteem and the body image. Right. Okay. Potential complications like infection, contractures, hypertrophic scars. I've said you this thing will hamper the day-to-day activities. They hamper movement. They hamper cosmetic value of the patient. So these are very important locations where you need to be very careful. Specialized treatments are required when there is like face is involved, joints are involved. You should be early with the surgical treatment of the burns because they are important regions. You should not allow complications to come. Before they come, you should address the area. Right. Age and health of the patient. Again, like any by with like similar to any other diseases, age is again a factor because young age, they have early response, they have good immunity, so they react fastly. They have good immunity, so they will the wound will heal sooner in young age people. So age related factor, physiological changes. As people age, their bodies undergo physiological changes that can affect their ability to heal and tolerate stress. For example, older adults may have reduced skin elasticity, slower metabolism, and decreased immune function. As I've said, the same thing, increased risk of complication. Older adults will have more risk of complications such as infection, pneumonia, and heart problems. Delayed healing. Yes, old age will have delayed healing. Pre-existing conditions again will help hamper the wound healing process. Diabetes, cardiovascular disease, respiratory condition. These are all which are playing their role in wound healing of the burns patient. Causes of burn. Yes, this causes of burn. I'll zoom it a little. Burn type. Thermal burns. Yes, I've said you there are types of burns like thermal, chemical, electrical, radiation. I've said you same thing. Thermal burns causes Hot surfaces, steams, flames, liquids, hot liquids, they are causes of thermal burns. Immediate treatment, they will be cool with cool water. It is written here as cool water, but you should not use cool water. You should use a room temperature water. Kindly correct. This is an just typing mistake in the PPT. It is not cool water. It is normal water, room temperature water. Ongoing care, clean will mild soap water, apply sterile non-stick dressing. Yes. Okay. Next, chemical burns, acids, alkalis, chemicals. Irrigate with copious water. Remove contaminated clothing. Yes. Immediate treatment is you wash it off with water. Clean with mild soap and water, again same. Remove contaminated clothing, neutralize chemicals. By washing, don't neutralize with any antidotes. If suppose you have a injury with acid and you pouring on the base will not neutralize it. Don't do these things. Never do these things. Always clean with only water, only water, only water. Running tap water is the only solution. You cannot add or do anything else to this. Again, you need to do pain relief and monitor for toxicity. Electrical burns, yes, electrical currents is the cause. Ensure power source is off, assess for entry and exit. Separate the patient from energy source immediately and take him or her to the safe area. Ongoing core, monitor cardiac function and for compartment syndrome, clean wounds and apply sterile dressing. Yes, you need to monitor cardiac function. Why? Because there will be cardiac arrhythmias, abnormality in electrical burns. So you should be very vigilant about this. Also, there will be electrolyte imbalance. So you should monitor electrolyte imbalance and also cardiac function. Internal damage may be hidden. Manage hydration and electrolytes. As I've said, see, this is the only special consideration. Pain management, and you have to radiation burns, ionizing and non-ionizing radiations of the causes. Immediate treatment is clean with mild soap and water. So basically, from this slide, what do you understand is any let that be any burn, let that be any type of burn, be it thermal, be it radiation, be it electric, be it chemical, be it any burn, any kind of burn, and how much deep ever it is, you should wash with running tap water. That's all. You don't do anything extra. With immediate care, all you do is wash the wound with running tap water. Yes, so this is all about causes of burn. Next, inhalation injury. As inhalation injury, yes, one more is another type of burn injury where there will be inhalation of poisonous gases and harmful gases which are released, and that inhalation will cause injury to the respiratory system. Assessing for the sign of respiratory distress or airway burns, which are critical in cause of fire or chemical exposure. Yes. So due to inhalation injury, what happens? There is an injury to your nasopharynx, your oropharynx, that is pharynx mainly. And then after that, there is an injury to trachea, and deep injury will cause injury to lungs. So you should be vigilant about the patient's airway. If at all, if the patient is not able to breathe, airway must be secured by placing the endotracheal tube inside the patient's mouth. So you are securing the airway. So you should be, it's a very dangerous injury where you cannot wash or do anything. This is another type of burn where you cannot wash or do anything. In inhalation injury, patient will collapse on the site, on the exact site they get collapsed due to not able to breathe, and then the only way out is intubation. So you need to take the patient to the hospital and secure the airway. Very dangerous type of injury is inhalational injury. Age and health of the patient. Yeah, again in this, this is depending on the color of the wound, and you decide what can be the degree of the burn, whether it is superficial or deep. Red or pink color, it is very obvious that it is first degree burn, or it is also seen in superficial partial thickness, that is second degree superficial is also the patient wound will be red or pink. Details. It affects outer skin layer or slightly deeper. I've said you in second degree burns, it is an involvement of dermis, that is superficial dermis is involved in superficial part of second degree. Only the papillary dermis is involved. So yes, bright red blisters. Again, whenever you heard of the word blisters, second degree burns is only you should get in your brains. Blister you have seen, you get simply write or believe that it is an second degree burn. It affects upper dermis, blisters form. It is very painful, sensitive, and moist wound. Yes, pale pink or mottled, deep partial. Second degree deep burns extends deep into the dermis, mottled pale due to reduced blood flow. Pain may be less intense. Yes, so it will be the blood supply. The blood vessels are also involved or lost here. So it will be pale pink color mottled due to less blood supply. So it is an second degree deep burn. White, leathery, charred, full thickness, third degree or fourth degree. I said you depending on type of or how much the depth is involved, it will be white or charred, black color. Penetrates all the skin layers, may appear white, brown, black, or leathery, often painless because all the nerves are involved and injured here. Yellow, brown, black, yes, it is an fourth degree. Indicates dead tissue or discharge. It is black in color, that means discharge is already formed. It is a deep burn. Yes. Main important topic why we are here for this webinar is surgical management. What is the role of surgery? Initial wound care and debridement. Yes. Whatever you have seen, the dead tissue which is there onto the wound is has to be debrided or has to be removed. Hysterotomy is nothing but the thick black colored discharge, black colored tissue which is formed has to be removed. Why? Because that plays a crucial role. If at all, if the chest is involved and due to the discharge formation, chest movements are hampered. Or if at all, if there is circumferential wound involved on the hand, it will also lead to the compartment syndrome of the hand. So that is why, that is the reason why you should not hamper the movement of the chest or you should not hamper the blood supply of the tissues. You need to do hysterotomy. You need to do fasciotomy. Debridement is necessary in such kind of wounds. Wherever you see dead tissue, discharge, you need to debride that wound. Next, second type of surgical management is skin grafting. There are various types of skin graft: autograft, split thickness skin graft, full thickness, allografts, and xenografts. Autograft, I've said in the detailed videos there on this skin grafting. You can go to the Prakara surgical videos and you can listen to that. I have detailedly explained all these things. Autografts, split thickness, how do we remove skin, how do we apply it, when do we remove the dressing, everything is detailed and discussed there. So skin grafting is a huge different topic which is done for this burns patient. Flap surgeries, yes, flaps are nothing but there is intact blood supply. It's not part of the skin which is excised. You remove the skin and the underlying tissue with the intact blood supply. That is flap. So there will be local flaps, there will be flea flaps. Okay, so this is flap surgery. Next, going to tissue expansion. There are tissue expansions available in case where extensive skin is needed. Tissue expanders can be placed under healthy skin to stretch it, providing additional skin for grafting. Wherever you are unable to graft the skin, then you do use this tissue expander. For example, if the whole of the body, 90%, more than 90% of the skin is involved in the burns, then all you do is tissue expansion. Tissue expanders are used because there is no skin left for grafting. Okay, reconstructive surgeries. These are very important. Contracture release. What are contractures? Contractures are nothing but there are pulled up tissues. Pulling up of the skin and the underlying tissue is lead to the formation of contractures. Contractures nothing but when the skin and the underlying tissue tighten and pull together during the healing process, leading to joint immobility. That is contracture. So what happens due to contracture? There is joint mobility dysfunction. The patient is unable to perform day-to-day activity due to this contractures. So what do we do to this contracture? For reconstruction, you release the contracture and which is hampering the joint movement, followed by skin grafting or flap. Scar revision. To improve the cosmetic and functional outcomes, scar revision is done. Scar is excised and reclosed. Again, next type is where the end of the treatment or end road will end here is amputation, where you cannot do anything. There is the limb is not salvageable. Then all you need to do is amputation. In severe cases where limbs are non-viable due to the deep burns or infection, amputation might be necessary. Post-surgical care, yes, here the role of physiotherapist comes in. Physical therapy to maintain function and prevent contracture. Physiotherapy is done. You keep constantly moving that part. not immediately after surgery, but post surgery after 2 weeks. All you need to do is physiotherapy. Pressure garments will be there, ongoing wound care will be done. Complications. Yes, immediate complication is shock, infection, respiratory issues, hypothermia, electrolyte imbalance. These are the immediate complications after burn. The patient will go into shock. Why I have said, why do the shock come? Because there is vascular permeability and vasodilatation in shock. That is the basic pathophysiology. What happens due to that? The blood, the water which is present in the blood vessels will come out into the interstitial space. Interstitial space. This leads to hypotension. The pressure will come down, and that will lead the patient to shock. Infections. Why is the infection? The skin is barrier, which acts barrier into the internal between the internal system and the external environment. The skin is the barrier. When this barrier is lost, what happens? The bacteria, viruses which are present, the microorganisms which are present in environment directly enter into the system. This will lead to the formation of infection. Respiratory issues. Yes, this is seen in inhalation. I've said you inhalation injuries, where there is an injury to your outer respiratory tract and inner respiratory tract. What happens is there is a difficulty in respiration. The patient collapses. There you need to secure an airway. That is an respiratory issues. Hypothermia. Yes, the skin acts as a barrier. I've said both for infection, also for the temperature control. When the skin is lost, the patient goes into hypothermia because water is evaporated from the body, and the patient will land up into dehydration and hypothermia. Electrolyte imbalances are also there. So these are immediate complications. Long-term complications, yes, scarring. The wound will heal by scar. I've said you there are three phases of wound healing. First one is inflammatory, second one is proliferative, third one is maturation phase. Maturation phase is where scar formation occurs. So yes, there will be sometimes scar happens normally, but there are few conditions where their scar formation is not normal, and the patient will land up in hypertrophic scar. If the scar formation is abnormal, it will lead to formation of hypertrophic scar. So this complication is always there for the burns patient. Scarring. Yes, contracture. I've said you. Pulling up of the skin and the underlying tissues during the healing process is called contracture, and this will lead to joint immobility and hampering the day-to-day activities of the patient. So contractures are again a complication. Chronic pain is present. Respiratory complication. Yes, psychological impact, a very important and very underrated complication which we do, which patient and doctor both sometimes get ignored about this complication. There will be a lot of psychological impact due to there is probably if there is a deep burn and extensive burn, there will be hampering of the day-to-day activities, and also there is a cosmetic loss to the patient. So the lot of patients face this psychological impact. Organ failure. Yes, lot of burns patient will go into shock, and there will be multiple organ failure. That is called as multiple organ dysfunction syndrome, MODS. Impaired mobility. Yes, I have said you already. Hypertrophic scar, keloids, nutritional deficiency, amputation is again a risk factor, and chronic wound healing issues. Special complications for electrical burns. I've said you cardiac arrhythmias. Electrical burn can cause immediate or delayed cardiac arrhythmias, including ventricular fibrillation or cardiac arrest. Next one is muscle damage and compartment syndrome. Electrical burns can cause muscle burn. Muscle will get burned out, and this will lead to deep damage, leading to rhabdomyolysis. Nothing but the muscle will break down. This is called as rhabdomyolysis. And due to this, what happens? The potassium present inside the muscle will leak into the blood. That will lead to formation of hyperkalemia. Rhabdomyolysis, nothing but muscle breakdown, will lead to hyperkalemia, and also there will be a risk of compartment syndrome, where there will be a surgical emergency leading to fasciotomy. Special consideration in pediatric and elderly patient. Yes, the burns in pediatric and elderly patient, you should be more careful, and you should, if at all, if there is no proper equipment there in your hospital, you should refer the patient to burns unit. Special burns unit will be there in special hospital, tertiary care. You should send the patients there. Are more vulnerable to complications from burns, including fluid loss, infection, long-term functional impairments due to thinner skin and less physiological reserve. Burns in special areas, again, I've said you face, hands, genitalia. are very special regions where you should be extra careful. You should be vigilant. Yes. So this is all about burns. You should be aware of all the complications and all the pathophysiology behind burns. So yes, I hope this webinar was informative to you guys. You came, at least got the knowledge about what are the degrees of the burn, what are the places, what are the areas where if there is burn, you should be extra cautious and vigilant. And what are the immediate complications and late complications of burn, and what is the role of physiotherapist, where you can save up the patient from the late complications such as scarring, contractures, where physiotherapists play a huge role. Yeah. So, any doubts?